National shortage of a crucial drug for type 2 diabetes is forcing some to have to think twice about what to do about their next dose. With no timeline on when Canada may receive another shipment of the 1 milligram Ozempic pens, patients are questioning why it's also being prescribed to an entirely different group of patients. Tyson Fedor reports.
Jack Stevenson is a type 2 diabetic taking weekly injections of Ozempic from his 1 milligram pen. But this past Saturday was his last dose, and with none in stock at various pharmacies across the city, he's unsure what he will do next, leaving him worried.
If I can't get it, what do I replace it with?
Stevenson, like many others, are in need of the prescribed drug. Novo Nordisk, the company that markets the drug in Canada, can't say when a new shipment will arrive, but suggests global supply chain issues are the reason for delays.
So why are you going to heavily advertise it when you can't supply it? Like, it doesn't make sense.
Pharmacist Dan Burton says he has had to get creative with patients and how to meet their medication needs.
Fortunately, we do have access to the Ozempic, the 0.25 to 0.5 milligram pens, but even they're in limited stock, so we can only get 5 a day, but at least we can kind of play with that. Maybe you were prescribed Ozempic or Wegovy.
Burton says it's not just type 2 diabetics receiving the drug, but those fighting chronic weight issues. Some medical professionals are prescribing it off-label. Health Canada says it does not approve of Ozempic for weight loss, but it's not banned either. But it's become a go-to drug to combat obesity in the United States, and that is spilling over into Canada.
Again, it's the balancing act of, well, who do we then triage, who do we say can get the medication or not? For both patients, it is a chronic disease, and to say we're going to seclude it and give it to just one patient population over the other, we're on a slippery slope if we suddenly decide to start doing that. So important to kind of look at the bigger picture and look at our government and regulatory bodies and that sort of thing.
But for Stevenson, he disagrees.
Is there a pecking order in terms of type 2 diabetics and then people who are on it for weight loss? Or is everybody just thrown in this kind of together, right? Because if you're on it for weight loss and you don't really need it right away, you can wait.
Tyson Fedor, CTV News, Calgary.